you through some of the substantive requirements for quality assurance, areas of recent OIG focus, and CMS guidance documents. Then my colleague Lynn Reinheimer will conduct a demonstration of our ComplyTrack solutions. Last, time permitting, we will answer some of your questions. But let's talk about quality in nursing facilities. Let's start with the statutory and regulatory requirements. As we all know by now, in March of 2010, the Affordable Care Act was passed. It included a requirement that the Department of Health and Human Services establish and implement a quality assurance and performance improvement program for nursing facilities. These are referred to as QAPI programs. HHS was required under the Act to establish standards, or what we know as federal regulations, and provide technical assistance to facilities on the development of best practices to meet those standards. We are still waiting for those regulations, but CMS has provided a great number of guidance documents, which we will talk about in just a few minutes. But first I want to address quality requirements under existing regulations. The existing regulations are part of the Conditions of Participation, or COPs. So you may need to demonstrate compliance if queried in a site survey. The regulations require facilities to have a Quality Assessment and Assurance Committee, a QAA committee. I've laid out the basic requirements for you on the slide. The regulation is pretty short and very succinct. So we look to the State Operations Provider Certification Manual for some additional illustration. The manual states that the intent of the regulation is twofold. First, to have the committee with its key members and for them to meet quarterly. And second, that the committee identifies deficiencies and develops and implements plans of action to correct the deficiencies. This includes monitoring the effect of implemented changes and revising action plans as needed. Let's talk about the makeup of the committee. You must have the Director of Nursing and a physician, plus 3 other staff members. CMS suggests that the other staff members may include 4 types of staff. First, an administrator. CMS notes that effective QAA members have knowledge of the systems in the facility and have the authority to change them. Second, the medical director. CMS suggests this because part of the medical director's responsibility is to guide development and implementation of resident care policies, as well as coordinate medical care. If the medical director is not a member of the committee, CMS encourages the exchange of information with the medical director, as it will enhance the functioning of the QAA committee. Third, CMS suggests that staff with responsibility for direct resident care and services be included on the committee. This would include nursing aides, therapists, staff nurses, social workers, and activity staff members. The fourth category of staff CMS suggests to include on the committee are staff with responsibility for the physical plant, such as maintenance, housekeeping, and laundry staff. With regard to meetings, the QAA committee must meet quarterly or more often if necessary to fulfill functions and operate effectively. But whatever the schedule, ensure you record the dates of all the meetings and the names and titles of the attendees. For the identification of quality deficiencies, CMS notes that facilities can collect and analyze performance data from a variety of sources, which may include record audits, facility logs, tracking forms, incident reports, and consultant reports. But one thing the facility should definitely track are survey deficiencies, because CMS has noted that if repeated deficiencies are not identified by the QAA committee, it may be an indication that they are not performing as required under the regulation. It is also important to note that quality deficiencies should not be limited to only those that cause a negative outcome, but also may be directed toward enhancing quality of care and quality of life for residents. Action plans. After a facility has identified deficiencies, it needs to determine or identify the root causes so that it can develop corrective action plans. Action plans may include the development or revision of clinical protocols based on the current standards of practice, revision of policies and procedures, training for staff on any changes, plans to purchase or repair equipment or to otherwise improve the physical plant, and standards for evaluating staff performance. The implementation of the corrective action plan, which the QAA committee can delegate to others, can vary, and it may include things like staff training and deployment of changes to procedures, monitoring and feedback mechanisms, and processes to revise plans that are not achieving or sustaining desired outcomes. Let's shift gears now and talk about recent OIG quality-focused activities, starting with the 2015 work plan. There were 5 project areas for nursing homes in the work plan, and 2 of them related directly to quality and safety. For background checks, the OIG will be looking to determine the costs involved in conducting background checks on employees with direct access to patients. For hospitalizations of residents, the OIG is looking at the costs associated with manageable or preventable conditions, and they squarely indicated in that project area that there may be a quality of care problem in nursing homes. Prior OIG work plan project areas for nursing homes have also focused on quality. One of those areas focused on the use of antipsychotic drugs. This has been very much a focus in the news lately. As many of you probably are aware, last Friday, the Nursing Home Compare site made several changes to their 5-star rating system. One of those was to incorporate the 2 quality measures on antipsychotic drugs into the quality measure rating system. The focus on quality from the work plan, especially that project area related to preventable conditions, is also present in other OIG work. There was a February 2014 OIG report on adverse events or harm resulting from medical care. There were several key findings in the report. I'm going to focus you in on 3 of them. First, the OIG found that 22% of Medicare beneficiaries experienced adverse events during their SNF stay. The adverse events fell into 3 broad clinical categories. First, events related to medication, like an altered mental state. Second, events related to ongoing resident care, like falls or a pulmonary embolism. Third, events related to infections, like a surgical site infection or an aspiration pneumonia. We see these general categories and the items within them in the quality measures and in other AHRQ safety and quality guidance. The second key finding of the report was that on top of that 22%, an additional 11% of patients experienced a temporary harm event. That is one that requires medical intervention but does not cause lasting harm. Harm events fell into the same 3 broad clinical categories, but they differed a little in nature. For instance, a medication event might have been a hypoglycemic event, a resident care event, something like a pressure ulcer episode, and an infection event, a catheter-associated UTI. In total, 32% of beneficiaries experienced a harm event while in a SNF. The third key finding of the report was that 59% of the events were clearly or likely preventable. The OIG noted that the factors contributing to those events included substandard treatment, inadequate resident monitoring, and failing to provide treatments. Notably, and tying directly to that 2015 OIG work plan area, the 59% of preventable events cost Medicare $208 million in 1 month. The report concludes that there is a need and an opportunity for facilities to significantly reduce the incidence of events. The recommendations coming from the report include having AHRQ and CMS develop a list of potential events. They note that staff identification of resident harm is critical to the success of safety efforts. The list would, in essence, help educate staff. Next, the list should be included in CMS guidance on the subject. And last, CMS should instruct surveyors to review facility practices for identifying and reducing adverse events. They would link any deficiencies noted directly to resident safety practices. Now, if the focus of that report is not enough for you, let's look at a recent settlement agreement, very recent, from October of 2014. Under the settlement agreement, the facilities, which was one entity and its subsidiary that were operating in 8 states, they had to pay $38 million to settle false claims allegations. $32.3 million went to Medicare, and $5.7 million went to 8 states and their Medicaid programs. The government alleged billing for substandard services. Indeed, the government claimed that the services rendered were so substandard as to be worthless. Some of the particular violations alleged are noted on the slide there for you. Now, this was the largest failure of care settlement with a chain-wide SNF in DOJ history. But I don't want you to think that the focus was an anomaly or a one-off, because there was another case just in 2013 in which the care was substandard as well, but it was so substandard to be criminally poor. And in that case, the owner was sent to prison for 20 years. So the OIG has been and will continue to focus on quality and safety in nursing facilities. The last major area that I want to discuss goes back to the CMS QAPI guidance documents that I mentioned at the beginning of the presentation. Although CMS has not issued the QAPI regulations required by the Affordable Care Act, it has issued a lot of guidance material. The seminal document is called QAPI at a Glance, a step-by-step guide to implementing QAPI in your nursing home. Now, some of this material is released with the survey and certification letters, but there's a lot of additional material on the website that hasn't been released with the letters. So I really encourage you to go there and look through those pages. I've put the URL on this slide so that you have it. The materials address and kind of start with 5 elements for framing QAPI in nursing facilities. CMS talks about these as building blocks for QAPI development. The first element or building block is design and scope. The QAPI program must be ongoing and comprehensive in nature, and it must deal with the full range of services offered by the facility, including all the departments in the facility. The QAPI should use the best available evidence, to define and measure its goals. And you should have a written plan that's based on those principles. The second element or building block is governance and leadership. the facility should develop a culture in which leadership seeks input from staff, residents, and their families. The governing body must assure that adequate resources are devoted to conduct QAPI activities, including designating one or more persons to be accountable for the QAPI program, providing leadership and staff training, ensuring staff time, equipment, and technical training as needed, and developing policies to sustain QAPI efforts despite any change or turnover in personnel. So the governing body should set expectations around safety and quality and resident rights and choice and respect. And they should also ensure staff accountability. Now, this is a bit of a balancing act because you want to ensure staff accountability, but at the same time, you want to create an atmosphere where staff is comfortable identifying and reporting quality problems and opportunities for improvement. The third element or building block is feedback, data systems, and monitoring. Here, the facility needs to put in place systems to monitor care and services, drawing from many different sources. There should be feedback systems for staff, residents, and their families, and there should also be systems to track, investigate, and monitor adverse events. The fourth element or building block is performance improvement projects. Performance improvement projects are done to examine and improve care or services in areas the facility identifies as needing attention. So it's a concentrated effort on a particular problem, and it can be in one area of the facility or it could be facility-wide. And what you do is you focus in, gather information to clarify what the problem is, and intervene for improvement. This is one area where CMS has issued a lot of documents and material on it. They have a worksheet that you can use to create a PIP charter, and they have a checklist and a couple of other documents. The last element is systemic analysis and systemic action. Here, the facility should use a systemic approach to determine when an in-depth analysis is needed to fully understand the problem, its causes, and the implications of change. It's a thorough, highly structured approach to determining whether and how identified problems may be caused or exacerbated. It's like a root cause analysis, which is one of the 10 action steps that a facility can use to further build on these elements and which are discussed in the QAPI at a glance document that I mentioned earlier. Given that facilities already have some quality obligations under the COPs, and given that facilities only have 1 year from the date the regulations are issued to submit their QAPI plan, I encourage you to start working on it right away. And now I'm going to turn it over to Lynn for a ComplyTrack demo. Lynn?
Great. Excuse me. Thank you, Darcy. So I'm going to bring ComplyTrack up right now. And what we're going to be talking about is how you can use the different components of ComplyTrack to assist you with a lot of the things that Darcy was talking about in her slides, making sure that your organization has the policies and procedures in place you need to have, that you're doing the education, that you're effectively responding to the issues that you're confronted with, documenting that response, and being able to provide evidence of the things that you're doing if need be. So I'm going to walk you through a few different pieces of ComplyTrack that can assist you with that. And the first piece that I have up on the screen is our Risk Assessment Manager. And what we're doing with the Risk Assessment Manager is we're providing organizations with pre-developed question sets that you can utilize to do your own internal risk assessment. And these risk assessments are geared toward a wide variety of entity types, including nursing facilities. So I want to take you through a couple different libraries of content that you could work with to be able to do assessment within your organizations specifically focusing on quality of care issues and areas. And the first library of content that I want to highlight is our nursing facility library for the OIG work plan. So Darcy had in her slide some of the project areas that are in this past year's work plan, but again, these quality-related areas have shown up in the work plan for years now. And we have work plan question sets that date back to 2007. So something like the antipsychotic drugs, which is not in the 2015 plan, but in light of some of the things and the emphasis that have been placed on it recently, you might want to go back and take a look at. You could go into some of our previous libraries for the work plan and be able to still do an assessment related to the antipsychotic drug area. I'm going to open one of the project areas from the work plan that we've developed question sets, one that Darcy mentioned, hospitalizations of nursing home residents for manageable and preventable conditions. When I open this, goodness, excuse me, got a Northeast Pennsylvania cold going on. So what we're seeing now is the question set for this particular project area. And what I want to highlight is if you see after each question in the question set, there is a citation link. So what we do with all of the questions that we include in our risk assessment manager is we tie the questions to the documents that the questions have been taken from. So when you're sending these questions out for response and the person's looking at them and they're not sure where the question came from, or they want to read more about it, or they want to see it in context, that you can click on the citation link and be able to see that. I click on the citation link for one of these questions. I can see it's coming from the OIG Supplemental Compliance Program Guidance, and it's coming from the regulations. And I can click on one of these links, and it's going to take me right into the source document. So now I can see why this question has been asked of us. So that tying the questions to the source document can function as a really nice educational tool for the individuals in your organization that might be responsible for answering question sets. Other libraries of content that you could work with from a quality perspective. We have a conditions of participation library, and we have all of the different conditions that a nursing facility would need to be in compliance with accounted for here. In the slides, Darcy was specifically speaking to some of the requirements that are in the administration condition of participation. So if I click on this and I scroll down a little bit, you'll see exactly what she was discussing as it pertains to the requirements for an Quality Assessment and Assurance Committee. So being able to go through and answer these types of questions, but again, even more expansively, you could look at the questions regarding restraint and seclusion and questions regarding quality of care and quality of life that are being accounted for here, and be able to focus in on the conditions of participation, which is especially nice because when you talk about and you think about surveyors coming on site, this is the type of assessment. These are the types of things they would be looking at when they step foot into your facility. So these are things that you can ask yourself to ensure when they do step on site that they're not going to find the issues that they're looking for from this perspective. You can assess it before they come in and assess it for you. And then also a library regarding the OIG Compliance Program Guidance and supplemental guidance for nursing facilities. So if your organization has a formal compliance program in place, this is a nice assessment to be able to go through and make sure that that compliance program contains what it needs to contain to be considered effective by the government. If you don't have a compliance program in place, or at least a formal one, then we have the content that you can work with to help you put that together and to determine what type of policies and procedures you need to be developing and how you want to set up your system for education or your system for auditing, as an example. But if I come into one of these question sets, the additional risk areas question set, and we scroll down a little bit, again, being able to look at things like psychotropic medications, so things that are going to be areas of focus for the government. A lot of those you're going to find addressed within the OIG's compliance guidance and supplemental guidance. So from a higher level perspective, you could use these question sets for assessment purposes as well. So when you go through and you conduct assessments, then you're going to be able to generate action plans based on the answers to the questions. There's a full library of reporting you can work with. But from a compliance perspective, this is really the first step, using this content to determine where issues might exist, where there might be holes, where you don't have policies, where you should be doing education. Starting here, once those issues have been identified, then you can use some of the other modules of ComplyTrack that I'm going to be talking about to help you manage your remediation and help you put into place the things that you need to be doing. So that is the first piece of ComplyTrack I wanted to highlight today. And this is the piece where Darcy and I co-manage the content within the system, giving you pre-developed question sets to do your own internal risk assessment. The next piece of ComplyTrack that I want to highlight is our Survey Manager. The Survey Manager allows you to create surveys on anything you want that you can send out to as many individuals as you might need to for response. So it's a nice way to communicate with your employee population, especially if your organization has a variety of locations, if you're spread out geographically. Being able to communicate can be a challenge, and this is going to help you with that. So you can create surveys. You could send surveys out to 1 or 2 people. You could send out surveys to your entire employee population. You could send out surveys to individuals that aren't part of your employee population. It can be a way to communicate with your business associates, or potentially a way to communicate with your residents and get feedback from them or their family members regarding the experience within your organization. This is a tool that we see our clients using enterprise-wide. So it's used in compliance. It's used in internal audit, human resources, IT. You can use it very expansively. I want to highlight one specific type of use of the system, and that's using it for document dissemination. So if you have a new policy and you want to get it out to all of the affected employees and make sure that they've read it and that they understand it and that they signed off on that, you can attach documents to surveys that you send out, or you can include links to documents. So you could attach the policy, send it to the affected employees. Or perhaps you're looking on the internet and you find that OIG report that Darcy referenced regarding adverse events, and you want to get that to some of your staff and make sure that they've read it, and you want to query them and see, do we have things in place that are going to address the things that are being discussed within this report? You could attach the report. If you want to educate staff and use this kind of as a de facto learning management tool, you could attach a PowerPoint and quiz them through the Survey Manager. So in this example, I have up just a little basic one that I created. In the third question, I have the report attached. So there's my link to the OIG Adverse Event report. And then my fourth question is my attestation question. Attest to the fact that you've received and read the document. So being able to hold individuals accountable for what I'm sending to them. And then if I wanted to, I could add additional questions onto this. But document dissemination, a huge use of the system. Other ways that you could use it, you can use it to help automate the internal audit process. So regardless of what you're auditing, auditors tend to have a list of things that they're looking for. If you're doing a record review, they're looking at certain elements regarding documentation and coding and things like that. If you're doing a policy review, they're looking at dates and content. If they're doing an environmental care review, they're looking at things throughout the facility. But they have a list, and you can build that list into a survey. So I'm going to bring up this particular example, which may not necessarily be 100% consistent with what we're talking about, but gives you an idea of how you could set these types of checklist surveys up within the system. So if you are walking through the facility to make sure that everything that the conditions of participation establish as far as the environment you're in compliance with, you can go through and check things off as you see it. And if you determine there's an issue, you can generate an action item on the spot. So I can use the Survey Manager for document dissemination. I can use it to help automate our audit process. You can use it to get feedback from employees or potentially those outside the organization by being able to do anonymous surveys. So if I want to query my staff anonymously to see, are they aware of are adverse event policies? Are they aware of what is considered an adverse event that needs to be reported? I could send out a survey where names won't be tied to responses. And I can make sure that my staff have received the appropriate education and everyone's aware of what to do in the event of a potential adverse or temporary harm event. It's going to make it easy for me to be able to manage the process, so I can come in to view survey assignments. I can pick any survey that I've sent out. I can be able to see who it's gone to and whether they've done it or not. I could filter this list by status. I could filter it by location. I could filter it by person. But people won't be able to slip through the cracks. If I'm sending them the survey, I'm going to know whether or not they're answering it. So I can make sure that everybody does. So the Survey Manager is a nice way for you to be able to communicate with employees that you might have scattered throughout a variety of locations or a geographic region. The next piece that I want to highlight, and I'm going to spend a little extra time in this piece, is our Activity and Event Manager. And the Activity and Event Manager is a tracking tool. It's designed to assist organizations in tracking all of the things that you do and deal with on a daily basis. So those could be issues or incidents you deal with. There is an adverse event that occurs, and now you have to capture everything you're doing and following up on it. You could capture and manage that here. But it also goes beyond issues and incidents and gives you the ability to capture things that you're doing because your policies and procedures say you're going to do them, or your compliance program says you're going to do them. So when you are conducting education with staff, when you're doing periodic auditing or monitoring activities, when meetings are being held. So Darcy was talking about the Quality Assessment and Assurance Committee and how that committee should be meeting at least quarterly, that you can capture when those meetings are being held and who attended the meetings and what was addressed. And you could attach the meeting minutes and keep all of that information together within the system as well. A couple of the nice features that you can utilize in the Activity and Event Manager: the ability to attach supporting documentation. When I was in consulting and I'd go into a facility and I'd ask for certain documentation, show me evidence of the education you conducted, or show me the report of findings from this investigation. It was often very difficult for those organizations to find that information for me. Where did they need to look? Who had it? This way you can attach all supporting documentation to this activity you're building into the system. So that could be a PowerPoint that went with an education session, work papers from an audit, a report from an investigation. If it's being maintained electronically, you're capable of attaching it here. So one place where you can come where you know you're going to find what you're looking for related to this activity. Email reminders can be set up. These can be one-time reminders, or they can be recurring reminders. For certain activities you conduct, there are deadlines associated with it. I'm going to go through the survey example in a moment. And when we talk about responding to a statement of deficiency and creating your plan of correction, there are time frames associated with that. Being able to set up email reminders to ensure as a deadline is approaching that the appropriate individuals are alerted to that is going to be very valuable, and you can ensure that nothing is going to slip through the cracks. As a deadline is approaching, if something's coming due, if something has to happen, that the appropriate individuals will receive the notification. Also, as an organization, you have the ability to customize the Activity and Event Manager site. You can build in the options you want to appear in the drop-down menus. You can add fields to the screen. So that way, if there's certain terminology your organization prefers to use or certain options that you need to build in for the type of activities you want to manage, that you have control of the screen and you can customize it as might be necessary. And it's going to allow you, if you choose to use this tool very expansively. We're talking about it with a very specific purpose in mind in a specific area within the organization. But we have clients that use this in compliance, for HIPAA incidents, breaches, activities, internal audit, in risk and quality, human resources, IT, legal, unlimited users, unlimited usage, security tied to everything. You can use this throughout the organization. The example that I have up on the screen is really in line with something that Darcy was talking about as far as the importance of tracking survey deficiencies. So in this example, my organization just had some state surveyors come on site and conduct a survey. They met with staff, they toured the facility, they did everything they were going to do, and now I need to be able to capture their findings, everything we're doing and following up based on their findings. So I've been able to describe what this activity is going to be about. And I can pinpoint the component of my organization it relates to. So if my organization has 8 nursing facilities, which nursing facility does this apply to? And I can categorize and subcategorize it because you're going to get different types of agency visits perhaps. So being able to pull out the appropriate group here. For any activity I build into the Activity and Event Manager, there are 5 main categories of actions I can capture: investigations, education, communications, audits, and a 5th category that we call agency. The agency category will assist you in capturing a very specific type of communication, and those are communications that you or others in your organization might be having with federal or state agencies, other groups, where you might be asking for advice or you might be reporting something. CMS, OIG, DOJ, FDA, IRS, whoever it might be. When I was in consulting, those are the types of communications I used to see captured on scraps of paper and Post-it notes, which don't generally prove to be the best way to maintain that information. But if you are contacting one of these groups and you're asking a question and you're getting advice, sometimes that advice isn't all that stellar. You need to document it. So if you're relying on that advice and something not fantastic happens, that you have the documentation there that you did everything you were supposed to do, and a scrap of paper isn't going to cut it in that case. But what this is doing for me on one screen is it's creating my log. At the top of the screen, I see the details of the state survey we're going through, and I scroll down the screen and I can see the details of everything that's been done and captured, taking us through things like the surveyors coming on site and sitting down and giving us their primary findings, and then getting the statement of deficiencies, and then being able to manage our plan of correction. So in this example, one of the issues was an issue with reporting resident abuse and investigating the allegations. So if I'm creating my plan of correction, I'm probably doing education. I might be developing policies and procedures. There could be monitoring involved. All of that is documented. All supporting information is attached. I can see absolutely everything that's happened in regard to the survey right from this screen. And at the bottom of the screen, with task functionality, I have a project management piece. So for those incidents or issues or projects that involve multiple people or span different departments or functions where different groups are going to be responsible for different elements of this response, I can document what needs to be done, who's going to be responsible for it, and I can manage these tasks within the system. So when someone completes their task, if I assign them the task, I'm going to get an email notification. I can search on tasks. I can report on tasks, but making sure we're meeting our deadlines. And perhaps the most important piece of all of this, being able to report on everything you're doing in the system. If this is the type of activity that you might be capturing on a spreadsheet or in an Access database, the reporting element of this is probably cumbersome for you, time-consuming. So we're giving you a lot of different ways you can report on everything that's being captured. I can come into this activity, in the upper right corner, click where it says Display Activity Report, and in 2 seconds, I'm going to have a PDF report that's going to show me everything that's been done and captured. So I can always click a button and have a report. Beyond that, we have custom reports you can work with. There's analytical reporting you can work with. So if you want to be able to track and trend the things that you're capturing in the system and see, are the same types of issues continually occurring? Are they occurring in the same locations? Are they involved the same people? How much education have we done this month versus last month versus the previous month? I can create pivot tables, and I can create pivot charts of what's being captured in the system. So I can very easily see where our issues exist. And I can be very specific. I might only want to focus for all of the types of things that might be captured in the application, I might only want to focus on adverse events. And I might only want to focus on 2 of my facilities. And I might want to do a monthly, a quarterly, an annual report. I can make those choices. And if I want to do a chart report here, there's a library of charting options that I can work with to do that chart report. So I come in, I've got my chart. If I prefer a 2D versus a 3D, a pie, a line, a bar, I can make those choices. So being able to do analytics, being able to very easily and quickly compile data to see where your issues exist. And that's just a few of the approaches to reporting. For the sake of time, I won't go into all of them, but there are quite a few approaches to reporting that you can utilize in the Activity and Event Manager. There is also a front-end piece that comes with this that allows you to be able to create forms and make them available electronically for employees or potentially residents or family members to access, fill out, and submit. So if you wanted to have a form, so when there is an incident on a floor, maybe there's a patient fall, maybe there's a medication error that you now need to respond to, that this can be reported into you. So any forms that you might have in a paper format today, you can make available electronically. When this gets filled out and this gets submitted, it feeds right into the Activity and Event Manager that we just looked at so that you can capture all of the things that you're doing in following up on this reported incident. You can put a form anywhere, so you can put a resident complaint form or any other forms that you want to make available to residents or family members on your website. You can have forms for employees set up on your intranet or a designated site that they can go to so that this can be reported into you. It's something that's designed to supplement a hotline, if you have a hotline in place, and give individuals another mechanism that they can utilize to report things into you. The last piece then that I want to talk about, and then we will go into any questions. So just to reiterate what Kelly mentioned in the beginning, if you have any questions for us, you can submit them on the menu bar with the Q&A option. But the last piece that I want to talk about today then is our document manager. And the document manager is giving you a place where you can create, manage the approval process for, and maintain over time all of the different types of documents that your organization works with. So those could be policies and procedures and all the policies and procedures that you have. Those could be forms, letters, PowerPoints that you use with education sessions. Looking back to the last slide that Darcy had in regard to CMS and the QAPI program and where that's going, one of the things that she was talking about were having templates to work off of when creating a performance improvement project charter. That's what I've built out here on my site. You have unlimited usage in the document manager, so you can build in as many documents as you want. You can maintain them in the system for as long as you would like. And what's nice about this is it is giving you a place specifically to manage all of your policies and procedures and make sure that they're being reviewed periodically, whether your organization's approach is to do it 1 year, 2 years, 3 years, however frequently it might be. Another experience I used to have when I was in consulting was to go into facilities, ask them to show me their policies, and assuming they could find their policies, which was never a given, that they would often be past the review period, well past, years past the review period, because you deal with so many policies and you deal with so many documents that it's very difficult oftentimes to stay on top of them and to be able to effectively manage them. Also, by being able to build in things like templates, like this particular performance improvement project charter template or other form templates in here, that you can ensure that your employees and your locations are using a consistent structure to be able to do this, and that they have the format that you want them working off of. So at the top of the screen, I can define my document and I can describe it. I can establish editors, and this is a really nice feature when we talk about policies and procedures and the importance of making sure that they're being reviewed and updated, because for any document, I can establish who I want to be able to review and sign off on that document. So if this is a policy, a draft policy, and I need 6 people to review it and make their comments and sign off on it, that can be managed here within the system. I can establish the order I want them to review it in. It is an automated process, so when it's their turn to review the document, they get an email notification. They come into the system. They come down to the bottom of the screen. They can open the document, and in a track changes format, they can make their changes to the document. So it's a very easy process for the editors. And then over time, as these documents need to change, as invariably they will, once the QAPI activities, for example, move a little further along, this template might need to change. Or your policies might need to change. Maybe the condition of participation will be modified and will change who needs to be on the Quality Assessment and Assurance Committee. That you can come in, archive the old version, be able to update it, and continue to maintain it in the application. And then the document manager also has a companion publishing site, so being able to make your policies and procedures easily accessible to your employee population. So instead of having to post everything to the internet, perhaps where it's very difficult to be able to manage that when policies change and removing older versions and posting newer versions, that employees have a place that they can go to where it's going to be easy for them to find what they're looking for in the first place, and that you're going to have a confidence level that they're actually accessing the version of the document that they should be accessing. So these pieces are all going to perform a function to assist you in ensuring from a quality perspective that your organization is doing the things that you need to be doing, that you're identifying your issues through the risk assessment, that you're managing your remediation and capturing the things that you're doing proactively as an organization to prevent issues in the first place in the activity and event manager. That when you're developing policies and you're managing your documents, that you have a place that's going to allow you to effectively do that. And then with the survey manager, being able to communicate with your employees. So at this point, we have about 10 minutes left in the Deminar today. So I'm going to turn this back over to Kelly and see if we have any questions that have come in that we can go through.
Great. Thank you very much, Darcy and Lynn. And we do have some questions that have been submitted during the presentation, and I would like to thank those who took the time to submit them, as we will address them now. The first question is going to be directed to Darcy, and this is coming from Sue, and Sue is asking, you told us about one of the changes to the nursing home compare rating system. What were the other changes?
Good question, Sue. 3 changes were made in total. One was the one that related to antipsychotic drugs, which I mentioned during my presentation. The second change was that they increased the number of points that were necessary to earn a quality measure star rating of 2 or more stars. So they made that a little more challenging. The third change was in the scoring method for the staffing star rating. Nursing homes must earn a 4-star rating on either the RN or the total staffing rating in order to achieve an overall staff rating of 4 stars.
Great. Thanks, Darcy. Next question is going to come to you as well, Darcy. This is coming from Tom. And Tom's asking, you cited the State Operations Manual. Can you tell us where in the manual to look for the information you covered?
Sure. Big manual there. So State Operations Provider Certification Manual, which is Pub 10007. You want to go specifically to one of the appendices. It's Appendix PP, as in Paul. And the specific tag is F as in Frank 520, F520.
Great. Thanks, Darcy. Next question is going to be directed to Lynn, and this is coming from Judy. And Judy's asking, are the pieces of ComplyTrack you showed us the whole product, or were there other parts that you did not demo?
There are other pieces that I didn't demo today. I wanted to focus specifically on the ones that would be most pertinent to your quality activities. But in addition to what we looked at, there is also a contract manager where you can, again, track information regarding the different types of contracts that your organization is entering into. There is an audit detail manager, which is a workflow tool designed to assist organizations in managing any claims-based audit requests that they're receiving. So thinking of groups like RACs and MACs and ZPICs and other groups that might be requesting records of you, that you can manage that process from when you first receive the request all the way through the appeals and to when you've resolved it. Excuse me. And then also our information security assessment manager. So we looked at our risk assessment manager, which is more of a compliance-focused assessment tool, but we also have an information security assessment manager geared more toward the security and the IT staff within an organization. So being able to do HIPAA security assessments, being able to do assessments related to meaningful use, and really being able to do that type of deep dive assessment, which every time you see a new breach being mentioned on the news is a nice solution to have available to ensure that that doesn't happen to you. So those are components that I didn't go into today, but also make up the overall ComplyTrack solution.
Okay, thanks, Lynn. We have two more questions left, and they're both going to be directed to Darcy. This one's coming from Lindsay, and she's asking, is there a limit to the number of QAA committee members?
No, there isn't. There's that 5-person minimum that you must have, but in the state operations manual, CMS specifically states that you can have a larger committee than is required by the regulation. So, yep, you can absolutely have a larger number.
Okay, great. Last question in the queue. This is going to be for Darcy again. This is from Paula, and Paula's asking, has CMS released any documents on root cause analysis, and can you talk a bit more about what they're looking for in a root cause analysis?
Sure. I think that I'll start with the second question first about what they're looking for in a root cause analysis. I don't know that they have a set formula that they're looking for or set steps that they want you to go through. The challenge in the process improvement area is really oftentimes is just getting to the heart of the problem. In the QAPI at a glance document, CMS has this big call-out box where they focus in on that, and they say that there's a danger in starting to try to implement a solution without thoroughly exploring the problem, and that often multiple factors have contributed, and the problem that you're looking at might actually be a symptom of a larger issue. What seems like something is simple may actually, involve a number of different departments. So I don't think there's any set formula, but they want you to be thoroughly exploring the root causes. But they have issued some documents to help with your root cause analysis. They have, I think, the last time I checked, 3 documents. The first one is a guidance document for performing a root cause analysis as part of the performance improvement projects that I talked about earlier. The second one is how to use what's called a fishbone tool for a root cause analysis, and that's really a kind of a cause and effect diagram, and they have a couple of pages on that. The third document is called the 5 Whys tool, WHYS tool for a root cause analysis. And that's really kind of a problem-solving technique that they're providing for you. All of those documents and many, many others in a lot of the other 5 element areas that I talked to you about earlier are on that QAPI site, which is on the slides.
Thanks very much, Darcy. That is all the questions that have been submitted. Once again, I would like to thank everyone for joining us today, as well as Darcy and Lynn. I hope you have a great rest of the day as this concludes our presentation on the OIG's focus on nursing facilities.